Today we will see burns part 3. In the last class, we saw the local changes due to burns. Today we will see the systemic changes. The systemic changes include shock, biochemical changes, changes in blood, systemic lesions, etc. Shock, oligemic shock. The direct effect of heat as well as liberation of vasoactive materials from the injured area, there will be increase in capillary permeability. This results in loss of fluid and protein from intravascular space. From there, fluid reaches the extravascular space. That is, there will be a volume shift as the extension of burns and edema and the bulbs that forms. This leads to oligemia, that is, decreased tissue perfusion and oxygen transport. Neurogenic shock. Neurogenic shock develops due to pain and apprehension. Cardiogenic shock, bacteremic shock after bacterial infection. These are the other types of shock seen in burns cases. Biochemical changes. Electrolyte imbalance, decreased sodium and chlorine and increased potassium in blood. Hypoproteinemia, hyperglycemia, increased blood urea, creatinine, etc. This is due to kidney damage. Next is changes in blood. Hemoconcentration due to exudate formation. Increased RBC due to outpouring of plasma. Decreased eosinophil count in first 12 hours. After 24 hours, eosinophil count rises. The rise in eosinophil count indicate good prognosis, and the decrease in count or failure to rise is a bad prognosis. Aggregation of RBC, WBC and platelets are common in burns. That means there will be increase in viscosity of blood. Anemia will be present according to the extent of burn. The amount of destruction is direct proportion with the third degree burns. Intravascular coagulation is also seen. Systemic lesions. Liver shows focal liver necrosis. Kidney shows hemoglobinuria, oliguria, anuria and death due to uremia. Adrenals are enlarged and congested. Gastrointestinal tract. Focal ischemia and ulcers are seen in GIT. They are called Curling's ulcer. Respiratory system. Alterations in the pulmonary functions can be seen. Increased pulmonary vascular resistance in immediate post-burn period. Pulmonary edema won't occur in fluid insufficiency. Endocrine dysfunction. Insulin and T3 levels are depressed. Neurogenic changes. Delirium, disorientation, decreased blood flow to brain. Immunological impairments seen in more than 50% of the burn surface. Increased microbial invasion due to poor immune response. Therapeutics of burns. First one, Apis mellifica. This remedy relieves pink, swollen skin with itching, burning pain improved by applying cold compresses. Cantharis. This remedy relieves blisters from burns or friction. Urtica urens. When a burn is mild and the primary symptoms are redness and stinging pain, this remedy often brings relief. It is often useful for sunburn when the pain is prickly and stinging. Arnica. This is a valuable first aid remedy to help reduce pain and swelling and prevent the onset of shock after any injury. Another remedy that is more specific to the burns should be considered after arnica. Belladonna. This relieves red hot and painful skin from burns or sunburn. Calendula ointment. This remedy has a slight antiseptic action, speeds up the healing of damaged skin, and keeps the skin moisturized. Causticum. If a burn is intensely painful and blisters seem to be forming, this remedy may help to bring relief. The person often feels more sad than restless from the pain. Rawness and soreness may develop in the injured area. Causticum is also helpful when the pain remains in older burns or when the burns have not completely healed. Hepar sulph. This remedy is helpful for treating very sensitive and painful burns in people who are prone to infection. The person may feel extremely vulnerable and irritable and may have chills or be very sensitive to cold. Hypericum. This remedy is often helpful when the pain of burn is intense and the nerves are extremely sensitive. Along with the usual discomfort of a burn, stabbing or shooting pain may be felt in the injured area. Phosphorus. This remedy may be useful for the pain of electrical burns on the way to medical care. When electrical burns occur, the damaged area may look small on the surface but be more extensive underneath. They should always be examined by a doctor. Some prevents infection prevention and promotes granulation tissue formation. Calendula prevents disfiguring scars. Calendula superficial burns that burns and itch intensely. Urtica urens prevents ailments from burns. Carbo animalis causticum picric acid prevents black deep burns which turns into gangrene. Arsalb. Thank you for watching. See you in the next class.